As ASCP continues our series covering the work medical laboratories are doing to combat COVID-19, we visit the University of Nebraska Medical Center in Omaha, Nebraska. In this, the second of a two-part episode, ASCP CEO Dr. E. Blair Holliday speaks with Dr. Stephen Hendricks, chair of the Department of Pathology and Microbiology, about the relationship between the university and state that led to the development of the unique biocontainment facility housed on the university's campus. They also talk about the critical role that laboratory science is playing to fight this pandemic.
It is a most distinct pleasure to be able to introduce you to the chair of the Department of Pathology and Microbiology here at the University of Nebraska Medical Center, Dr. Stephen Hendricks. Dr. Hendricks, thank you for taking the time to meet with us today.
Pleasure to meet with you.
There's a story that I'm not sure the rest of the country knows, and I'd like for them to hear it. And that's how you as a visionary determined and decided to develop a biocontainment unit here at the University of Nebraska many, many years ago in order for us as citizens of this country to get ahead of emerging diseases such as this one.
A long, long time ago, the Public Health Laboratory moved to the University of Nebraska Medical Center largely for financial reasons and, again, support by the state. And so we became the Public Health Laboratory here at the University of Nebraska. That allowed us to integrate all of the scientists in microbiology and provide the support for really what was good laboratory science at the time. Because of our interest in supporting the rest of the state, developed an in-state communication strategy so that if anybody needed help, the public health could help them. And working with the chancellor and the lieutenant governor at the time, we said, maybe this is the time we need to take advantage of a CDC guideline that every community needed to be prepared for up to 100 individuals in some way for an emergent disease. Which then, working with the governor and the lieutenant governor, we were able to get that funding connected to the idea to build a biocontainment unit, meaning an in-hospital treatment center for patients with such things as influenza.
Is there any other center such as this in the United States?
At the time, there was only what was known as the Slammer at USAMRIID, which was our model. So we went to USAMRIID, studied what they did, so we basically took all the good lessons from the Slammer at USAMRIID and built them into our facility.
What can we do and what can you showcase for us as the opportunity for this novel biocontainment facility to be able to support the needs of coronavirus and COVID testing and in patients who are affected by this condition?
We've actually seen it again, and we saw it not that long ago with Ebola.
Right.
The goal of the biocontainment unit and the effort is to buy time for the rest of the country. So how can we immediately respond to something a challenge we can't predict? We've got to be able to have an immediate response while the rest of the country gets geared up and the government gets geared up. Because I think in time, the government will gear up, the states will gear up, but you've got to buy enough time to hold off the enemy, as it were, until that capability comes to full power.
When the virus first began to emerge in our country and folks that were being transported across the world that were Americans were coming to Omaha, weren't they? And they were coming to the facility that you had the visionary engineering to design. Tell me a little bit about, without having to go into the specifics, a little bit about, was it ready? Was it prepared? And is it doing what you engineered it to do?
Well, as you can imagine, it's gone far beyond what we had originally anticipated. It's there to provide education and training. Right. So you've got to have people willing to sit and train and practice and train and practice some more when there is no problem. And so people are saying, are we really wasting effort and time here? But in fact, that's the proof is that there is always going to be something, and you've got to be ready for it and have some emergent immediate response available.
Do you think our public health laboratories, our academic medical centers, our reference laboratories in this country, do you think they're going to help us spool up at least the amount of throughput for laboratory testing, but the public is going to heed the warning on the public health side to flatten this and make sure that we have the minimal amount of exposure possible?
The public is now informed, and I'm very optimistic that this will be shut down. So given the beginning of it, when you don't have a lot of people active and engaged, yes, it could have been a terrible disaster. I think in the end, this will be the positive outcome, although I know a lot of suffering is going to take place between now and the end.
And what's your perspective on you as a citizen of the United States, as a taxpayer of the United States, living in a country, a democracy, where you're looking at leveraging the resources this country has, which are massive.
Well, now you're dealing with the really major issue. In my opinion, we are making the right moves. We are coming together as a country, and the investment is taking place that needs to take place. But it's based on people having paid their taxes for the last 50, 100 years that allowed us to get here, even though they didn't necessarily know that that was well spent. It was money well spent in our public health administration.
What would you say to the public in terms of assuaging their concerns or their fears about what's happening in the current media, or for even that matter, their own dialogue amongst their own family members?
Well, I wish I could just come right out and say something would make them all feel better tomorrow. But actually, the real message is the truth. And the truth is that the investments have been made in America in education, in public health. And that's what's being brought to bear right now. And that's what you will be seeing. And our families will be seeing it as time moves on. Unfortunately, up to this point, maybe a lot of effort hasn't been made on seeing what happens in a laboratory or seeing what happens in public health. It's really been an invisible front line in most regards. It's because these people have been doing their life work for 50 years, if not longer, and making the investment in what needs to happen right now, which is the science, the education, the training, and I believe in the end, a very positive outcome.